Hai saudara, apa kabar Anda hari ini? Semoga selalu sehat, semangat, dan bahagia. Kalau kita bicara soal kanker, kanker tidak mengenal usia. Kini semakin banyak kasus kanker yang ditemukan pada orang berusia di bawah 40 tahun. Kanker payudara, kolorektal, dan tiroid menjadi jenis yang paling sering menyerang generasi muda. Padahal ada asumsi mereka terlalu muda nih untuk terkena kanker. Selain itu, kanker langka meskipun secara individual jarang terjadi, namun secara kolektif menyumbang lebih dari 20 hingga 25% dari seluruh kasus kanker. Dan tantangan utamanya adalah deteksi dini, pendanaan penelitian, dan akses pengobatan yang tepat. Namun kabar baiknya adalah pengobatan kanker kini semakin berkembang. Pendekatan medis, imunoterapi, terapi terarah, dan pendekatan multidisiplin memberikan harapan baru. Di Singapura, kemajuan teknologi di diagnostik dan kolaborasi antar spesialis memungkinkan pasien mendapatkan perawatan yang lebih personal dan juga efektif. Lalu bagaimana kita bisa mengenali gejala kanker pada usia muda? Dan apa saja inovasi terbaru dalam penanganan kanker langka dan kompleks? Selama 30 menit ke depan kita akan mengulasnya secara lengkap bersama saya Dian Mirza dalam Bincang Kita. Joining with us now at the Kompas TV studio, Dr. Valerie Yang, medical oncologist from OncoCare Cancer Centre, Singapore. Hello, doctor.
Hi, Dian.
Thank you for taking this interview.
My
How are you?
pleasure, thank you.
And also Dr. Natasha Putri, surgical oncologist from Glen Eagles Hospital, Singapore.
Hi, Dian.
Thank you for taking this interview, doctor, for allocating your time.
Thank you. Very happy to be here.
All right, I'm going to Dr. Valerie first. As it mentioned earlier, there are common types of cancer and also rare cancer.
Yes.
What is rare cancer actually, and what sort of, classification of rare cancer?
Yes, Dian, thanks for the fantastic question. So rare cancers are actually any cancer that has an incidence of less than 6 to 15 in 100,000 people. So that's what we mean by rare. Okay, so even though they are individually rare, they are still a very big problem, because if you add them all up together, they actually account for between 20 to 25% of all cancers. So it's a significant number actually. Okay, and of course it's a big problem, because when things are individually rare, it becomes a lot more challenging to treat these cancers as well. So it's not just a simple, situation of treating a common breast cancer or common lung cancer or common colon cancer. It's a situation where we need to take a step back and think, what should really be the best management for these types of cancers. Okay, so some examples of rare cancers, there's a whole long list of them actually, okay, but they can include things like sarcomas, which happen to occur also quite frequently in young people. Okay, they can include some types of skin cancers, including melanomas in Asian people. Okay, other cancers such as Merkel cell cancers, even anal cancers, or even other rarer types of skin tumors and some types of lymphomas. So again, there's a long list of many of these types of tumors. And I think what is also important to note is that some of these less common cancers, okay, actually are occurring in younger people. Okay, so I think that's also what is a little bit more challenging to deal with, because I think in these younger individuals, first of all, we don't expect to have cancers.
So it's true that it's the fact that cancer is increasing in young people then.
Yes, no, you are absolutely right. And it was not just an issue of the fact that we are detecting cancers earlier now. It is actually a real increase in people who are age 50 and younger. Okay, and there seems to be a consistent increase. This isn't just a single blip as well. So I think collectively we see people of Gen X, millennials as well. I'm a millennial myself. I think Natasha's a millennial too. And even in Gen Z, okay, we have patients at this age groups coming to see us. All right. In fact, the data shows that there's been an 80% increase in these types of cancers between the years of 1990 to 2020 for people under the age of 50 years old. Okay.
Yeah. What are the causes?
Yeah, that's a great question again, Dian. So the causes for this are under active investigation, okay? Some of the known associations include things like just the fact that someone is a little bit more obese, so obesity is an associated cause with increased risk of cancer. Lifestyle factors, so having a sedentary lifestyle, alcohol use, and even stress can sometimes contribute to a higher incidence of these cancers. The other active area of investigation, which people are looking to a lot more these days, is the impact of the environment on the generation of cancers. So including things like the air we breathe, the water that we drink, okay, and even the microbiome. So the microbiome really refers to the population and types of bacteria that might be living on our bodies, okay, especially our guts. And that is also thought to contribute to whether or not we develop cancers in the younger age.
However, there is an assumption, in public, saying that for young people generally, oh, I'm too young to have cancer. Your point of view, doctor?
I completely agree with that point. I think all of us are far too young to get cancer. The thing is that, this may not be something that we like to hear. But at the same time, I think it's so important to not be scared. Actually, I think we should all be brave because these are things that we can tackle. And there are many, many things we can do to help ourselves. So, we talk about cancer prevention. There are good things we can do to try and prevent this from happening. But even if not, okay, it's so important that we detect this early. So early detection is so important as well because I think there's so much more that we can do if we were to detect this early. And of course, with this, the best treatment for cure is also equally important. Yeah, so I think don't be afraid. Yes, it's shocking, but we can deal with this.
I need that sort of, positive vibes. Dr. Natasha, how would a young person know when they should see a doctor for possible cancer and what the signs that shouldn't be ignored?
Sure. It is not easy to know early when you have something that might eventually turn out to be cancer or is already cancer. But I think some of the easy pointers and principles to remember would be first to get to know your own body well first, such that if there are any changes in the patterns of your regular rhythm, such as if there is any change in your appetite levels, in your energy levels, or you suddenly notice that I'm having problems sleeping, or my bowel habits are now very different, then you're very attuned to it early on. And also, if you start feeling any discomfort anywhere, don't leave it alone and wait until it becomes pain or persistent or becomes very severe. The second thing is to see if these symptoms don't go away after 2 to 3 weeks. They persist even after trying medicines, trying certain therapies, and it still doesn't work, it's still there. Do seek help early, or if the symptoms comes back and comes back more often, pay attention to what are the triggers or the patterns that makes these symptoms comes back. Basically, just remember, don't wait until you start developing systemic signs and symptoms. You lose weight, you start feeling very low, or the appearance of a lump or a nodule somewhere, then only then come to seek help, because those are often the indicators that it's later on in the disease already.
Shouldn't be ignored then, So what's the uniqueness and what sort of challenges, especially when you're treating young cancer patients compared to the other one, to the older ones?
Yes, for sure. The emotional impact of a cancer diagnosis on a young cancer patient is huge. It's very big. They go through an emotional roller coaster. They start going into denial sometimes. Why is it me? I'm too young to have cancer. Or they start getting very angry, and this anger is directed oftentimes not just at themselves or the doctors. It can be to their loved ones, their friends and family members as well. They can sink into depression and feel very sad and be very affected by it. Psychologically, the impact is huge on many, many aspects. Their body image confidence, if after going through therapy, they have reminders of scars of all the treatment that they went through, their perception or their self-identity is very closely linked to, I am a cancer patient, I have this disease all the time. It can also have a huge impact on their mental health, and important to remember that it's not just the patient that's afflicted that has all these issues, but the family members that's supporting them as well can also face these these challenges.
All right, we're
Yeah.
gonna continue this very exciting topic, but we need to take a break for a little bit. So don't go anywhere, jangan kemana-mana pemirsa, tetaplah bersama Bincang Kita. Terima kasih Anda masih bersama kami di Bincang Kita, masih bersama dengan Dr. Valerie Yang dan juga Dr. Natasha Putri. Dr. Valerie, although it's uncommon, rare cancer collectively account for 20 to 25% of all cancer cases. What are the biggest challenges, in treating rare cancers? And why is it so important to go early to the specialist?
Yeah, Dian, thank you for asking that question. It's a very important question. And, even when someone is thought to have a rare cancer, it is an unexpected surprise, okay? Even for most doctors, if they come across a young person with a cancer that is not so common, okay? So it is a big challenge, really, because it is so unexpected to get the right diagnosis, first of all, okay? And also to get the right diagnosis quickly. I think that's also very important. Even things like the right investigations to get to the right diagnosis, I think that's also very important, okay? In fact, even when getting the right diagnosis, a lot of doctors are sometimes unsure of how to treat these less common cancers, okay? So I think, those are really the key challenges here when it comes to managing these less common cancers and cancers in the young. In fact, because of this, sometimes what happens is that we often see that many of such cases end up coming to us quite late, to seek expert help. So I think sometimes it's just worth knowing that if there's any suspicion, of a young person having a less common cancer, if there's any unsurety, do come and seek help early, seek out the experts early, because a lot can be done, okay, and a lot can be done very well as well. Yeah.
So what sort of, precision medicine and how does this approach differ from conventional or common cancer treatment?
Okay, so precision medicine is really a hot topic, okay, and it's also an actively evolving field. So really precision medicine is about looking at the patient's specific genes as well as their cancer's genes, okay. Not only just the genes, but also proteins and other unique biomarkers, and not just conventional cancer treatment where we look at just the type of tumor alone, okay? So with conventional cancer treatments, most of the treatment is based on the tumor type, and what works for the average person who has that type of tumor, okay, rather than it being tailored to the individual. So when we talk about precision medicine, it's really about personalizing it to the individual, their specific genes, their specific proteins, and even the biomarkers.
Unique.
Everybody's unique, and oftentimes we can actually tailor the treatments to the specific alterations that we find in these genes or proteins.
That's very exciting. Dr. Natasha, in treating cancer in young patients, what special considerations must be taken into account, such as fertility, maybe long-term effects and quality of life?
Yeah, you're right. So in treating a young cancer patient, or really what's important is in treating any cancer patient, we want to focus on not just only, we go beyond just cure. Not just only treating the disease. We look at the patient as an individual, as a whole, as a human being, and we look after all the other aspects of this individual as well. So certainly in a young patient, fertility would be one of the foremost issues. Sometimes some of the treatment, if they do require removal of any tumor within the abdominal cavity, for example, if they need to take some chemotherapy or receive radiation to some areas, that can impact their fertility. And very early on in the conversation, when they are diagnosed with cancer, we link them up with a fertility specialist to see if they need to do any egg harvesting, egg preservation, or even sperm banking in males. A second issue would be for young patients, they'll have this very big concern. Is this disease going to be passed on to the next generation? So that's where we introduce things like genetic testing to see whether this is something that is genetically influenced. And so we see whether there's impact on their subsequent family planning, childbearing plans as well. And lastly, the journey we walk with a young cancer patient is a very long one for many, many decades to come as they go through different stages of life. So we keep a very close watch on them to make sure that the cancer doesn't come back, and if it does, we detect it early and we deal with it early. We also keep monitoring them to see whether they're suffering any long-term side effects from any therapy, whether they need hormonal therapy, whether it's their mental state, for example, that also gets influenced by other things that's going on in their lives. So many considerations in the young.
It's not only curing them, yeah?
Yes,
but,
yes.
So what is the role in surgery, the role treating rare and complex cancers, and how do you collaborate, with medical oncologists like Dr. Valerie?
Yeah. I am but one small part in a very big team, and Dr. Valerie Young is also a very important part in this multidisciplinary cancer care team. As a surgeon, when a patient first comes to me, oftentimes they have a lump or a nodule or a symptom or a complaint they're concerned about. So I do biopsies. I take a small sample of the tumor through a procedure, and so that this can be sent for microscopic analysis to find out what kind of tumor, what kind of cancer it is. And after we know what is the disease we're dealing with, we may do additional tests like going for more scans, MRIs or PET scans, doing blood tests, sending for additional tests like the precision medicine that Dr. Valerie was talking about. And then we also assemble other experts and collaborate, and based on all our combined experience, come up with a very coordinated care plan. So everyone is on the same page. There's no confusion. This doctor says something, another doctor says something. We are all focused on treating the same thing together. Secondly, as a surgeon, if after the discussion during a tumor board meeting, we decide that this tumor or this disease is best treated by surgery, that's where I come in. I do an operation or surgery procedure to remove this tumor as quickly and as safely as possible. Or if the first line therapy, be it radiation, systemic therapies, unfortunately, if they don't work, or the tumor comes back, or only responds partially, and we have to find other ways of dealing with it, then as a surgeon, I come back in again. Yes.
So, mostly patients came to the Dr. Valerie first, or the other way around?
It can be both ways. Sometimes it's from Valerie first, they find a medical oncologist. Sometimes they come to me, and then after I see that, hey, I think this tumor is something we better dealt with using systemic therapy, I involve Val in the care as well. Yeah.
We work very closely together. So depending on who the patient comes
Never
to
separate.
Yes. It's a
So
tight
Dr.
team.
Valerie, how about you? How do you collaborate? If you have a patient came to you, how do you collaborate with other oncologists such as Dr. Natasha?
I think as a medical oncologist, we deal with the biology of the tumor, okay, and we also coordinate the care as a whole. So I think, other specialties that are closely involved in this very close-knit team, such as Dr. Natasha, surgical oncologist, there are also radiation oncologists. So those are local types of treatments where either it's surgery or radiation, and there are other local ablative therapies that also can be used by doctors such as interventional radiologists. So the role of the medical oncologist is really to put it all together, and together we think about what is the sequence, at which this cancer should be treated. So a lot of cancers actually benefit from having, some systemic treatment upfront first. So whether it is chemotherapy, immunotherapy, or targeted therapies, sometimes we think about whether we can shrink down the tumors before they go for, definitive treatment with surgery or radiation, okay? Or sometimes it makes sense to go for local treatment first, followed by systemic treatment later. So that's why there is a close-knit team of doctors that actually collaborate very closely to manage these cancers.
Okay, our discussion is getting hotter. We'll be right back because we have take a little break. Jangan kemana-mana pemirsa, tetaplah bersama kami di Bincang Kita. Terima kasih Anda masih bersama kami di Bincang Kita as we continue our conversation about cancer in young people and rare cancer. Dr. Valerie, what the latest innovations in cancer treatment, such as immunotherapy, targeted therapy, and liquid biopsy that will bring new hope to patients?
Dian, thank you. That's a very big question, actually, and somewhat long to answer, but I'll try to keep it short. So the good news is that actually there are so many new treatments today and so many new innovations. Thank you for bringing that up. In fact, just 20 years ago, when we first started treating patients, there was really not so much options available, but today there are so many, okay? Many more effective treatments, even beyond just chemotherapy. Okay, and you mentioned some of those examples. You mentioned targeted therapy. I'll start with that. So targeted therapy really strikes at the heart of the cancer. Oftentimes, they are actually oral inhibitors now, so oral tablets that you can take, which actually very effectively kills off the cancer cells that are dependent on these pathways to grow. Okay, we talk about immunotherapy. Okay, so immunotherapy is also very interesting. Immunotherapy that we use today really refers to immune checkpoint inhibitors. So what that does is that actually activates our T cells and makes sure that the T cells are able to kill cancer cells as effectively as possible. But that's just immune checkpoint inhibitors, okay? Don't forget we also have many options nowadays, including bispecific antibodies, tri-specific antibodies, even things like antibody drug conjugates, okay? In fact, there are also other immune cells in the repertoire of our immune system that can be used to target cancer cells, okay? So T cells is just one of them through immune checkpoint inhibitors, but we also have natural killer cells or NK cells, we have cell therapies, we have CAR T therapy. So I don't know if you heard of CAR T, chimeric antigen receptor T cell treatment as well. There are also mesenchymal stem cells that are actively under investigation, microbial vectors, even mRNA vaccines, which we rolled out very quickly for vaccination in COVID. But actually, the similar kind of technologies can be used and are actively being investigated in cancer treatment as well. Okay. So I'm very happy to say that actually we have many examples of patients who have been on these newer therapies that are now made available to patients. And, side effect profiles are actually not high at all. Some of my patients, in fact, come to us saying, hey, Dr. Val, I don't even feel very many side effects at all. Are you sure you are giving me treatments? How come I don't feel side effects? But at the same time, they are responding so well. The pain that they initially had decreased. The tumors that we can see on the scans are also all reducing in size. Some of them even disappeared. So very good responses with sometimes minimal to even no side effects. So very happy to see that, with the newer treatments these days.
Very rewarding, yes.
It's so rewarding, and it's no longer a situation of, doctor, I have cancer, I don't know what difficulties I'm going to undertake with the treatments. Things have really come a long way from 20 years ago. So not to be afraid, and I'm so happy that, this is the case for us today. Dian, you mentioned liquid biopsies. So I've just very quickly mentioned that as well. So liquid biopsies are an investigation which we can now use where we don't always have to use invasive procedures to get at the tumor itself. We can actually go via the blood. Okay, so a simple blood test can actually allow us to track response to treatments. Okay, I think the first thing is to see whether or not we can even pick up, the DNA that's from tumor that could be in the blood. Okay, so for example, in lung cancer, we can often pick up these DNA from the tumor that is in the blood. Okay, and we can match that to actually targeted inhibitors that we can take as an oral drug. Okay, what happens is that we can actually look at not only what mutations are there from the tumor in the blood, okay, we can also look at how that changes. Because as the tumors try to escape whatever treatment it is that we are giving to them, they start to develop new mutations. And so if we detect this early, what we can do is can then change treatment earlier, give them a different drug where they can actually cover both mutations at the same time. okay? Rather than wait for the next scan, to tell us that, there's a big tumor growth or it has gone elsewhere. So we can actually tell whether there's resistance early on and give more effective treatment from early on. Yes.
Innovation besides the in terms of medical technology, what's so unique about Singapore treating the rare cancer patients and cancer in young people?
Yeah. So I think the good thing about Singapore is that we're small, but we're special, right? So Ned and I are both from Singapore. I think we're quite well trained from where we are. So for me specifically, I trained out of Cambridge University. I did my MB PhD there. I also trained out of National University Hospital, National Cancer Centre Singapore, and I'm now at OncoCare Cancer Centre. So in fact, there are a lot of young and unique and these rarer but complex cancer cases that actively seek us out actually from all over the world, right, Nat? And I think the good thing is that we've got access to cutting-edge treatments, cutting-edge investigations. I think I mentioned some of them earlier on as well. And with liquid biopsies, for example, detecting resistance early means that we change treatment early. We can maybe use a drug that will actually cover both mutations at the same time rather than just the one. Okay.
All right.
Yeah. And I think out of Singapore, we've actually managed to set up and run a whole translational program.
Right.
So really, it's cutting-edge research, but also translating it to the patient. Okay.
Okay.
And we've used this information actually really to benefit every single patient that comes through our doors. And oftentimes, what we find for the patient, we can, for lack of better option, apply it to the patient based on what we found from their tumor, from their blood and from their cancer cells. So in fact, a lot of this work is now published and we're recognized internationally. We are also part of several global cancer consortia across the world. So I'm part of the Atlas Asian Consortium for clinical trials. We're also involved with the the global actually EORTC and the Global Rare Cancer and Young People Cancer Groups. So really, it's not just cutting-edge treatments and best care, but I also just want to say that we really see every patient and journey with them individually throughout. Okay, because like what we mentioned before, being young, and having a cancer and having something that is not so common, okay, is very, very challenging to anyone who is in that situation, So I think having the ability to seek out the right experts, who can deal with this is so important, just so that we minimize delays, we get the right things done, okay, and know that you're not alone, okay. We do this all the time, we know what to do, we know how to handle this, and I think it's so important that we take charge, of this patient's particular care.
All right, we all know that, Doc. Dr. Natasha, as an Indonesian doctor practicing in Singapore, what can be learned from the healthcare system and multidisciplinary collaboration in Singapore? Just very brief.
Okay. There's a very strong support that we get from the government in terms of public education. We have campaigns to raise awareness about what the common diseases, common types of cancers are, what symptoms to look out for, how to seek help early. There's also active participation by the members of the public themselves in terms of going for vaccination, going for screening. So all of that helps to just raise the healthcare standards as a whole. In the medical field, we receive very generous support by being able to go overseas to learn from the best experts so that we bring back the best practices such that whatever we do in Singapore is in line with the international standards, to better it even if we can, as well as a very strong focus on evidence-based medicine. It's not just hearsay or guesswork. There's a lot of emphasis on data collection, on data protection, quality control as well. We come up with workflows that are more efficient so that there is a reduced delay from the first time the patient comes to us to the earliest time the patient gets the therapy it's as minimized time as possible. And lastly, I think what's most important is to build strong networks, between different departments, between different experts, so that you can tap on the collective knowledge and expertise. So sometimes it's not just between different experts in the same hospital. We establish collaborations with other hospitals within a whole country, or if even need be, there are many international collaborative networks we have with many renowned centers of excellence all over the world.
Any tips, Dr. Natasha, to you share? Can you share in public what early detection and awareness and to prevent and detect cancer early?
Okay, maybe we'll just keep this simple and short so it's easy to remember. First, it's important to know that cancer is not just a disease of the old. It can happen to young people, it can happen to anyone. Two, if we already know what the risk factors are that increase the risk of cancer, avoid it. Don't smoke, no vaping, e-cigarettes, IQOS, reduce your alcohol intake, don't take any at all if possible, and start on the good habits when early, while you're still young. Regular exercise, healthy diet, go for vaccinations. And the last thing would be, if you do notice that there is something wrong and you're not sure, go look for help early. And when you seek more information, it's important to find a credible source. Not everything that you see on social media is always accurate. So it's always a good thing to check back with your doctors again.
Thank you very much, Dr. Natasha and Dr. Valerie. It's very, insightful discussion. It's very eye-opening, and hopefully it brings new hope to, many patients all over the world. Thank you very much once again.
Thank you for having us.
Thank you.
Dan saudara, melalui perbincangan hari ini kita belajar bahwa tidak ada yang terlalu muda untuk memperhatikan kesehatan. Kanker pada usia muda dan kanker langka memang menantang. Namun dengan deteksi dini, pendekatan medis dan kolaborasi multidisiplin, harapan untuk sembuh semakin besar. Dan jangan takut untuk mencari bantuan, temui dokter lebih awal dan jangan abaikan gejala yang tidak biasa. Pengobatan kanker hari ini lebih penuh harapan dari sebelumnya. Dan dengan ilmu pengetahuan, kerja tim, dan kesadaran dini, kita bisa mengubah hasil pengobatan bahkan mencapai kesembuhan. Semoga informasi ini membuka mata kita semua tentang pentingnya deteksi dini dan penanganan yang lebih baik. Saya Dian Mirza, pamit undur diri, sampai jumpa di bincang kita berikutnya.